Margaret, I think you're muted.
Okay, so sorry everyone. I was muted. We want to welcome you today to Centralina Area Agency on Aging's webinar series. This webinar series this month will be on falls prevention. We have a few Zoom webinar feature features we want to go over. You will be automatically muted through the whole webinar. You will not be able to see other participants, but you can see the speakers and the hosts here at Centralina. Please ask any questions that you may have through the chat box. Secondly, this session is being recorded and will be available later today, and we will also post it on our website at centralinaaging.org. Our speaker today, we're happy to welcome, is Michelle Mai. Michelle is the Program Associate with the Center for Healthy Aging. She brings experience conducting outreach, increasing public education with the community. In her role at NCOA, Michelle provides technical assistance to chronic disease, self-management education, and falls prevention grantees, striving to help them reach their grant goals as they implement evidence-based programs in their community. Michelle received her master's degree in public health and a bachelor's degree in community health from George Mason University. So now I'd like to welcome Michelle.
My goodness, thank you so much for the introduction, and good afternoon, everyone. Thank you so much for having me here today. And I'm really excited to share with you a bit more resources that we have here at the National Council on Aging, as well as our Falls Prevention Awareness Toolkit in preparation for the observance in September. Next slide, please. Thank you. Oh, you advanced. Yeah, the slide's perfect. So at the National Council on Aging, we have so many departments. There is a benefits team, there is an advocacy team, and within my team at the Center for Healthy Aging, the Center for Healthy Aging actually is home to 3 national resource centers, and those are the National Chronic Disease Self-Management Resource Center, the Modernizing Senior Centers Resource Center, and then finally, the National Falls Prevention Resource Center. And the purpose of the Resource Center is to provide support to local organizations and partners who are implementing and sustaining evidence-based falls prevention programs. And so with that, we have an entire repository of resources from marketing to strategies around recruiting leaders or recruiting participants, as well as different ways to engage with health entities to further embed these programs into the community. And so with that, the goal of the Resource Center is to increase public awareness of falls prevention. We provide resources in our repository to local organizations who are offering programs. Then also we strive to think of different ways to help these organizations and AAA organizations like yourselves to promote these evidence-based programs, because we know that older adults who participate in these programs that have been through a rigorous review process, because they've been proven to yield positive results when they participated, thus reducing their risk of falls and preventing these falls injuries. Next slide, please. And of course, we're all here today because we recognize that falls has a negative impact on the lives of older adults. We know that falls are common and costly, but they are preventable. Everyone here has a role to play, and we can make a difference no matter where we live or where we practice, because together we can make an impact on the lives of older adults. We know that falls can lead to serious injuries, causing traumatic brain injuries and hip fractures, and ultimately that leads to a decline in mobility And at the Falls Resource Center, our goal is to help local organizations expand, implement, and sustain evidence-based falls prevention programs and to help shed light on different ways to prevent falls. Next slide, please. So one important group here at the National Falls Prevention Resource Center is the Falls Free Initiative. The Falls Free Initiative was created in 2005, and it is a network of partners who are dedicated to preventing falls and other injuries. And some partners that are part of the Falls Free Initiative include the Administration for Community Living, the CDC, also local, state, public health entities, and other professional associations. Currently, the Falls Free Initiative has 70 national stakeholders and partners, and it also consists of 48 state falls prevention coalitions. And together, everyone is striving their best to bring awareness, education, and evidence-based interventions to older adults in local communities. Next slide, please. One observance that came from the Falls Free Initiative is the Falls Prevention Awareness Day observance. In 2007 was the first time this observance took place. And the goal was to essentially help our local communities understand that falls are not a part of aging and that falls can be prevented. And of course, the purpose is to raise awareness about how to prevent falls and falls-related injuries among older adults through education, action, and advocacy. And so in 2020, we expanded the one-day observance from Falls Prevention Awareness Day to Falls Prevention Awareness Week. And this year, this September, it'll be our 15th year honoring this observance. And so with that, next slide. I'm really excited to share with everyone today the theme for this year's Falls Prevention Awareness Week, and that is strengthening community connections in falls prevention. We know that clinicians such as occupational therapists, physical therapists, pharmacists, or someone's primary care physician have such an important role in making sure that the older adults remain falls free, and as well as providing different strategies to help them maintain their balance and mobility. But what happens when the older adult is home in their neighborhood? It's not like they have access to or their occupational therapy's direct number where they can call and talk to them, but they have resources in the neighborhood or the community that play such an important role in falls prevention, whether we realize it or not. So hence this year's theme is the neighborhood or your community. And in this graphic here, there are 5 community resources that have been selected specifically to ensure that every older adult or every individual, no matter if they live in a very quaint town or in a very busy city, if they see these 5 community resources, hopefully they can identify where these resources are in their own area. So we have here a sporting goods store, a library, a senior center, the hardware store, and faith-based organizations. All right, so now I would love to dive into the Fall Prevention Awareness Week Toolkit. So I would love to share my screen here. Just a moment. Kristen or Margaret, can you confirm that you can see my screen okay?
Yep.
Okay, thank you so much. So here is our Falls Prevention Awareness Week Toolkit, and it's extremely easy to get there. In case you don't have the address handy, you can just go to ncoa.org/falls toolkit, hit enter, and it'll take you to the toolkit. And if you scroll down You'll see here that Falls Prevention Awareness Week this year is September 18th to the 24th. Even though at NCOA we observe the entire week of September for this observance, if you are interested in dedicating the whole month of September for raising awareness and education, that's completely fine. If you don't have the time or capacity, but you're interested in doing something, a one-day observance is completely okay too. It's dependent on how much time and energy and capacity that you have. And then here, it's a reminder that the theme is around community connections and falls prevention. And then also a reminder to take our survey, which I will talk about towards the end of my presentation. The reason why I want to share with you this toolkit is because there are some really interesting resources in here that might be very helpful as you're planning your observance this September. So one resource I'm really excited to share with you is this interactive image here. It says to click on each building and see how your local community can help. And if you place your cursor over the buildings, your cursor will turn into a pointer. And that's an indicator that you can click on it. And when you click on the buildings, a pop-up will appear and it has a one-line summary of how these resources contribute to falls prevention. So you'll see here, I clicked on the library and it says libraries provide information for you to learn about falls and find trusted resources to understand your risk factors. That's the same with the senior center. And this is available for every one of you to copy the HTML code and put it into your website. And we do have instructions down below, which I will share in just a few minutes. So if you keep scrolling here. So now we have a section on new resources for this year's Falls Prevention Awareness Week campaign. The first one is an article on how falls prevention is a team effort. Again, I mentioned that when you think of falls prevention, you think of your clinical team, but then you also have other members in the community that contribute to falls every day, and we don't even realize it. So if we scroll down here, here's a whole list of your falls prevention team. I understand there are many other members and personnel to add, and this is a growing list, and certainly we will add those different individuals on future Falls Prevention Awareness Week campaigns. But you can go into here, let's say you're interested in learning how your local fire department or your hardware store has a contribution to falls prevention. Go ahead and click on that and it'll jump to the section that you were interested in reading in. So I encourage you to read this or perhaps print it out and share it with the older adults that you serve so that they understand a little bit more about the different members of their falls prevention team, whether they realize they had one or not. And then the next one is how to plan a falls prevention awareness and screening fair. This is a quick guide on how to plan a health fair that is very focused on falls prevention. And the reason why this was created was because after last year's Falls Prevention Awareness Week, I received a lot of comments from professionals who were very new to the world of falls, and it was their first Falls Prevention Awareness Week observance, and they were interested in hosting an event or a fair, but they didn't know where to begin. So while this does not go into all of the details of planning a falls prevention event, it does highlight the different items that you need to be aware of, such as funding, such as the key logistics to planning, different ways to market the event, because you want to make sure that people are attending this amazing event that you spent so much time and energy putting together. And of course, the most important aspect of a fair would be the activities. Engaging activities are the best way to convey education and messages to the participants. So there's a whole list here and of course, how to assess that your event was a success and different ways that it can be improved for future events. So this is here for you to consider. And then finally, this is one resource that I'm truly very excited about. And this is titled 4 Tips to help you talk to older adults about falls prevention. And falls prevention is one of those really sensitive topics where it's a little challenging to approach someone about the topic of falls. But to be very honest, all of us at some point or another, we will have to talk to someone about falls, whether it's our own family members, our neighbors, our friends, or even just people around us. So certainly it takes a community to ensure that the people around us, especially older adults, remain falls free. And one of the easiest ways to do that is to talk about it. So this guide, what I love about it is that it empowers you to talk about falls, even though I know it's a little challenging, and it lists, some ways or some reasons why you should. One reason is that it enhances relationships, and you'll see here, there are some sample questions and facts and experience. Scroll down, you'll see that another reason to talk about falls is that it creates opportunity and it fosters connections. So I encourage you to take a look at this handout, print it out, share it to all of the others in your network, and then perhaps you can take one of the examples and put it in your back pocket for the day where you have to have this conversation, because it doesn't need to be hard. It is hard, but that's one of the best ways to raise awareness about this important health issue. So I'm really excited about this resource, and I hope that you'll find this resource handy during this month of September and beyond. And then scrolling down, it's a really comprehensive toolkit, but I want to make sure that there are some really popular items in here that you are aware of and you can use it this September and year round. And then the most popular part of our toolkit is our social media toolkit. And this consists of pre-made messages that you can use and post on Facebook, Twitter, LinkedIn, or any other social media platforms that you use. So go ahead and click on the PDF. There's also a Word version available. Let me zoom in here for you. Okay, so if you scroll down, there's some best practices on how to engage with others on social media. But if you scroll down here, here is the creme de la creme. Here are the pre-made messages. All you have to do is just copy and paste it onto your social media platforms. And you'll see here, there's one for falls risk, and it directs people to the falls free checkup, which I will talk about after this. There's one around home modifications and home safety. There's another one on the importance of fire departments and how they contribute to falls prevention. The fourth one is around the falls prevention team. And then last one is the importance of talking about falls. And you'll see here, this is specifically for Facebook because I think there's like a word count or a character count. Here's one specific for Twitter. And then here is one for LinkedIn. And then we also have some sample email messages that you can use to send to your partners or older adults that you serve as well. If there's anything on here that you want to modify to best fit the community that you're living in, you're welcome to do so. And while this is designed for September for Falls Prevention Awareness Week, you can certainly use this year round. And then moving down here, we have some graphics for you to use with the messages that we put together or with any of your original posts that you end up using. So part of our falls prevention is a team effort. We have a suite of pictures. So of course, this one is on family and friends. So you'll see here, this is what it looks like. I'll take a look at the OT for you here. It has a little one-liner of how these different individuals contribute to falls prevention. I'll take a look here at the PT. And so you're welcome to, even though they're social media graphics, you're welcome to download them, put them on Facebook as like a wallpaper banner. If you just want to use it as a graphic for any other post, or just you really like how it looks, you're welcome to print it out and use it however you wish. And then I mentioned earlier that there was an HTML code for the interactive image. It's right down here. And then we've provided some helpful instructions on how to embed that into your website. So if you have any questions, reach out to me, but I believe the instructions should be pretty straightforward. And then just a reminder, we have some other resources here for you to print out and give to the older adults you serve, or just for you to read and learn more. And then also we have a section on our falls free checkup. We'll talk about that in just a minute. And then scrolling down, I know it's a really long page, we have a media toolkit. So there's a template in there that helps you put together a press release, as well as other best practices you need to prepare for an interview with a local reporter. And then finally, advocacy, some resources here as you plan to engage with your local decision makers. All right, so I'll stop sharing my screen here and I'll turn it back to Kristen to go back to the slide deck. Thank you. So if you go on to the next slide. One more. Okay, perfect. Thank you. So I mentioned the falls free checkup a few times, and you might be very familiar with it because this was the digital assessment that we deployed back in 2020 when everyone was home amidst the pandemic. And thankfully, with the support of some partners at Amgen and the CDC Foundation, we have redesigned the falls free checkup. And essentially, the falls free checkup is modeled after the CDC Stay Independent brochure with the 12 questions, except the checkup is essentially just a digitized version of that. I know you might be wondering, why does CDC have a different name, the Stay Independent brochure, whereas NCOA renamed it as the falls free checkup? We just wanted to make sure that this digital tool was in line with our other suite of digital tools, such as our benefits checkup. Hence, we named it Falls Free Checkup. And also, we got inspiration from the Falls Free Initiative group. And so if you go on to the next slide. And so if you are not interested, or if the older adults you serve are not interested in using the digital version of the Steady Stay Independent brochure, you're welcome to print out the guide that, or the questions that CDC has online. But the nice thing about the falls free checkup is that everything is digital. So once the older adult answers it, they can either print it out, they can email the results to themselves. And with the redesign, there are some more personal actionable steps at the end, such as reminding the older adult to schedule an appointment with their doctor to review the results because they were high risk, or reminding the older adult to take the assessment again 6 months, because so much can change and your health can change in a matter of just 6 months. So that's just something to consider, but I'm really excited to share with you all that our checkup is new. It's been redesigned and it's available right now for you to use. And so next slide, please. So I know Falls Prevention Awareness Week is next month. I can't believe time is flying by. And I have some ideas for you to consider if you haven't started planning for Falls Prevention Awareness Week, or you're in the middle of it, you're not sure where to begin. Well, have no fear. I have a couple of examples for you to consider. So in this slide here, this is for anyone and who has very little time, very little capacity, but you want to do something to participate in the observance in September. And the first thing is to talk about falls prevention. Use that guide I shared earlier, the 4 tips to talk about falls, and use that and create a challenge for yourself or for your team, or for your family members. Perhaps talk to someone, anyone out in your community, in your neighborhood, about falls. And have that challenge be talked to at least one person every day during the week. But if you're an introvert and you're not comfortable talking to people, especially random people, maybe make that a challenge of, let me talk to one person throughout the entire week about falls, because you never know what that person might learn from your conversation with them. And then the next one, super easy, go to the social media toolkit that I shared earlier and just copy and paste the messages and post it on your social media platforms. You don't even have to revise it. If you're interested in revising it and making it look more specific to your audience, that's fine too. But if you're stuck on time, just go ahead, copy, paste down to Facebook or Twitter and just post it. And of course, use an image because posts with images tend to get a little bit more attention. And then finally, the third suggestion is you can print out all the resources and handouts that we have available on our toolkit and give it out to all of the older adults that you serve. So those are suggestions if you're stuck on time and you just want to do something, but you don't have a lot of time and commitment to plan out a whole event. And then if you go on to the next slide, this one, it's a little bit easier, I think, but it's not as intense as planning a health event. So the first one is coordinate a webinar or presentation and present to an audience that you haven't presented to before and share resources around falls prevention and connect them to the different programs and services in the community. I think the more that people are aware of the different programs, the falls prevention programs and different social services that are available, the more that people are willing to enroll in them or register for them, and then also take charge of their health and be empowered to learn more and ensure that they're aging with dignity. The second one is to engage with one new partner. I'm sure all of you have so many wonderful partners that are part of your falls prevention efforts, but perhaps sit down and identify one entity or one group that would bring a lot of value to the amazing work you're doing. So reach out to them, form a connection, and maybe this is the perfect opportunity to do that presentation or webinar and explain how falls prevention is so important among the aging population. And then the third one, promote your evidence-based falls prevention programs. If you're planning to offer, let's say, a Matter of Balance or Bingo Size or Tai Chi this September, and you're already doing your marketing efforts, perhaps amplify it some more, print out a calendar, pass it out to the different organizations that you work with, and they can pass it to their older adults, because the goal is to ensure older adults are aware of the different programs, such as these evidence-based interventions, have them enroll in them, and perhaps you can make it a little bit of a fun challenge and encourage them to bring a friend to the program when they register. And then you go on to the next slide here. This is my last slide around different ideas for activities. This one does require time and effort, I believe. And one of them is to plan a falls prevention health event or a health fair in your community. And it's a wonderful way to bring the community together and educate everyone, no matter their age, around falls prevention. Even little kids can learn something, even your parents, and then also the older adults in your area. And then the second one, this one is not as intense as planning a falls prevention event, in my opinion, but perhaps putting together a falls risk screening event or a day. And I know when you think of falls risk screenings, I know the Timed Up and Go comes to mind. I know there are some other ones. And when I think of screenings, I think that I need to go see a specialist or a doctor to get this done. That's true, but for the observance, there are 3 digital screeners that are available to help older adults get a glimpse of their health. And hopefully that is a great segue or a great conversation starter for them to go and see a clinician. So is it okay if I go ahead and share my screen and quickly go through the 3 digital assessments? Okay. Okay, so again, the first one is our falls free checkup. It's just 12 questions. They're yes, no questions. And then after the older adult answers it, at the final page, there's a tally at the end. As you might know, 4 or more means they're at high risk. And then there is a series of actionable steps that they can take to address their falls risk. And you'll see here, there's a little question mark. And if you click on that, it provides additional context as to why this question is being asked. And so hopefully you enjoy this new redesigned version of the Falls Free Checkup. I know a lot of time was spent on this. So this is here for older adults to understand a bit more about their falls risk. The next screener that you can provide is the fracture risk calculator from American Bone Health. Bone density is also an important health issue among older adults because not many of them are aware that their bones are getting softer, and it just happens with age. And so the American Bone Health has put together an amazing fracture risk calculator for older adults or anyone who takes a calculator to understand the status and health of their bones. And it asks a lot of personal questions, to be very honest. It asks for the age, gender, any chronic conditions, any medications that the person has taken, such as chemotherapy. And then at the end, it calculates and then it gives you your result. And then from there, hopefully, if the older adult has a result that isn't desirable, that will encourage them and motivate them to bring that result to their doctor and then have further conversations about maybe getting a DEXA scan or a bone density scan and other treatments that are available. And then finally, I thought this one was really interesting. So here is a screener to evaluate your hearing. And what happens is you get started and it plays different sounds in the community, such as birds chirping or the wind blowing, the leaves rustling, and you kind of indicate whether or not you hear it. And at the end, it calculates and it determines whether or not you're at risk of a hearing loss. And while this is not a substitute for seeing an audiologist or a hearing specialist, again, I think this is a great conversation starter for someone who may be experiencing hearing loss. And I believe it is recommended that if you do use this hearing screener, to wear earbuds, because I know sometimes the speaker of a laptop or a tablet may vary upon one another. So I'm going to share my screen or stop sharing. And then Kirsten, if you can share your screen again. Yes, so the purpose of the falls risk screening event is to maybe have one room be the falls free checkup, another room be the hearing, and another room being the bone screener. Or you can just kind of have one screening each day, or you can have one screening each week so that people can better understand their health. And then next slide. If you are really intrigued to hear what other organizations have done for Falls Prevention Awareness Week, I recommend that you check out our impact report and go to pages 8 through 12. There are over 20 examples of how people observe Falls Prevention Awareness Week, and hopefully you'll gain some ideas and be inspired to offer an activity or some other awareness event for the older adults you serve. And then next slide, please. And then finally, this is the Falls Prevention Awareness Week survey I mentioned earlier. So the toolkit has been designed and developed for professionals like you to use as you serve older adults this September. But we want to know whether or not you like the resources and whether or not there are different resources that we can produce in the future. So this is to get feedback from you. Also, we'd love to understand how many older adults did you work with and how many older adults did you engage with during your observance. And so with that, I encourage all of you to complete the survey. It is due by November 1st. So you have all of October to analyze the participants and get your experiences and numbers added to our survey. The numbers and experiences and other items shared into the survey will be featured in our impact report. In terms of feedback and ideas for future resources, I will be sifting through those, and then those suggestions will help me determine which resources to create for Falls Prevention Awareness Week 2023. Okay, so with that, if you go to the next slide, that's all I have for you today. Thank you so much for having me here today. And if you have any questions around the toolkit or any other thing related to falls, feel free to reach out to me.
Michelle, thank you. Thank you so much. That was so informative. Couple highlights I'd like to talk about was thank you for providing the history of when the falls prevention started and how it has evolved over the years as we have all evolved, you might say, technology wise. We put the toolkit. There was a question about the toolkit and how to find it. We put that in our Q&A box for everybody who is on the webinar. And the other thing is, I think what I love about your toolkit this year is talking about who is out there in the community who can support falls prevention. And as you mentioned, it's a very, very sensitive subject. So sometimes it is maybe helpful to go talk to someone you know in the community or whom you don't know. Right. We do have a question from some of our participants. Donna mentions that she thought you'd have a great presentation. At one point, you stated there were 12 questions older adults can answer for falls risk, but I thought I saw 13 on one of your slides. She just wanted to make sure she got the correct information.
Yes. So Kirsten, do you mind going back to the slide with the falls free checkup screenshot? So you are right, Donna. So if you go just one more. Yes, so you'll see here, see that question where it says optional, whose information will you be providing? They have decided to include that as one of the questions. So that makes it a total of 13. If you decide not to answer that question, which you don't have to, then it's just 12 questions. So out of habit, I've been saying 12 questions because it is an original 12 questions from the CDC brochure. But thank you so much for pointing that out. Yes.
All right. Thank you, Michelle. Another question came out. Maurice wanted to know and I am so happy you provided this information too on hearing, as there's so many things that can impact your balance and falls prevention. How does testing hearing help in preventing falls?
That's a really good question, Maurice. I wish I had a background in hearing, but I don't. But upon researching, we know that there are some fluids in our ears. And if there's an imbalance of the fluids in our ears, it ultimately does impact our balance and whether or not we can stand upright or not. And so with older adults, if they can't hear, it means that there's something going on anatomically inside their hearing system that I don't know much about. But even though, sorry, I'm trying to put my thoughts together. Even though this test doesn't really tell them does not diagnose them, but it gives them an idea that there's something wrong with my hearing. If my hearing is impaired, it ultimately will affect the rest of my body. This is a key sign that if I have undesirable results, I need to go see an audiologist or a hearing specialist to make sure that all of my senses are working okay. So that's a really good question. I don't think I provided enough scientific research for you, but I believe there's some research online that you can look at and how hearing truly does have an impact among older adults with their balance.
Wonderful. Thank you, Michelle. And that is a great point. I think the other messages that are so wonderful to hear, and as community workers, you might say out here, that this falls prevention is not just in 1 month. It is year round, and not to be afraid to maybe send out the message over and over again with all the different tools that the NCOA has put together, because sometimes someone might not hear it that one time in September during that week, but they might hear it in February or March. So great to have all those tools. Thank you.
Yeah, just to echo what you shared, Margaret, even though this falls prevention awareness tool has been designed for this 1 week in September, you can revisit it anytime throughout the year. We know falls takes place not just in September, but every other 365 days of the year. And unfortunately, we only update it once a year, though. So that's the only downside, but everything is still relevant. So I encourage you to explore the toolkit and use the resources that we have in there for you.
Good, thanks. Oh, yes. So we had several questions about slides, presentation, links to the seminars, and we will provide those all on our Centralina website at the probably by next week. I don't want to rush it. Well, Michelle, thank you again. You were a wonderful resource of information, and I encourage everybody to go on the NCOA website and check out that Falls Toolkit. Now we'd like to introduce Ellen Bailey. Ellen Bailey is the North Carolina Falls Prevention Project Manager for the state, and she works at the North Carolina Center for Health and Wellness up in Asheville, North Carolina, a wonderful place to be and to look out the window when you're working up there. She is also very active in as I said, the state North Carolina Falls Prevention Coalition. Ellen is a certified Matter of Balance coach, and she's also a coach of Tai Chi, and she works as an instructor with the Arthritis and Fall Prevention Group. So Ellen?
Hi, yeah, thanks for having me. And thank you, Michelle. We work as the North Carolina Falls Prevention Coalition. We work closely with the Falls Free Coalition that Michelle mentioned, and also definitely utilize and share all of the NCOA resources that Michelle just shared with you. So thanks for inviting me to join. So our State Falls Coalition, our mission is to reduce the number of injuries and deaths from falls in North Carolina. It's a short and simple statement, but it's a lot of work. So we meet quarterly, and we are a group of diverse partners from across the state who work in different communities and work in different areas. So really multidisciplinary. Next slide, please. So we do have a state website. The link is here, ncfallsprevention.org. And on our website, you can find a link under resources to the toolkit that Michelle just mentioned, as well as some state-specific resources. And I'm going to highlight just a few of those today. But this, if you go to this site, you can find all of the resources. We have a special falls prevention awareness link as well for state-specific activities, and I'll highlight just a few of those. You can look at some past meeting presentations. For example, last week, Margaret, along with another registered dietitian, presented on nutrition and fall risk. So you're welcome to check out all those resources. We also have a data link if you want to look up specific numbers, for example, in your county, hospitalizations, emergency department visits, that sort of data that helps to advocate for attention to falls prevention statewide. You'll see at the bottom of this page a link to our action plan. We're currently working on a 5-year action plan to reduce injuries and deaths across our state due to unintentional falls. And if you go to the next slide, under that about link that you see here, you can also link to regional falls prevention coalitions across the state. So we currently have 7 active regional falls prevention coalitions, which is a great way to connect with the local partners on the ground in your area. So you know exactly what are the programs offered in my area, who's working on what in my county. So I encourage you to find yourself on this map. And if your county, the county where you work or live, looks like it's part of a current coalition based on the coloring, but you're not yet aware of them, please either email me or go to this link and connect with them. And then if you're located in a county that's not currently associated, definitely email me, and I'll share my email at the end so that we can connect you. And we're looking for champions. We hope by the end of 2025 to have all of our 100 counties connected to a falls coalition. Next slide, please. And as Michelle mentioned, one of the things that we do in North Carolina for Falls Prevention Awareness Week is every year since 2009, we've requested the governor's proclamation for Falls Prevention Awareness Week. Even though we have to request it 4 months ahead of time, we usually get it the week of Falls Prevention Awareness Week. And this is a great tool for your events. For example, if you're hosting an event, you could invite a community older adult or a local leader to read this at the event. In an organization, I've heard from several people across the state that this has been a really useful tool to share with their administration and their organization to draw some attention to falls prevention. So keep an eye out for this on our website. Next slide, please. And some state-specific resources that I wanted to share with you for Falls Prevention Awareness Week this year. We're hosting a placemat contest, and the contest closed last week, but we'll be sharing all of the placemats and the winners next week. And these are great tools to use for the home delivered meals, congregate meal sites. If you can get the placemats out at lunch meetings in your organization to kind of highlight falls prevention, this could be a great tool for you. We're also hosting a statewide calendar of all of the events that partners are offering across the state. So please have a look at the link and see what's happening in your area. And please be sure also to post an event if you're hosting an event. That way the public and providers can find it. I mentioned the governor's proclamation. There's also a statewide virtual event called Exploring the Magic of Tai Chi for Arthritis and Fall Prevention that anyone can join, and it'll be appropriate for healthcare providers. There'll be some research shared, as well as possible program providers or participants, and we'll actually do a little demo. So if you're not familiar with it, it'd be a great opportunity to learn more about it. And also this year for Falls Prevention Awareness Week, we're promoting the clinical community connections so that and referral pathways. So helping healthcare providers connect their patients to these programs in the community, such as Tai Chi for Arthritis, for example, or Bingo Size. So there's a survey that we'd love for everyone to take that will help us learn what's working well and what could work better in North Carolina around referrals. And also a Falls RX tool that providers can use. So that's available at the link on our website. And look, speaking about falls prevention programs across the state, you can visit Healthy Aging North Carolina, which is our statewide resource center for evidence-based falls prevention programs. We support becoming a trained leader. We also support collecting the data for this state. So you can find current and upcoming classes listed here if you're interested in sharing that in your communities. And lastly, I just wanted to mention that joining your regional coalition as well as the state coalition can be really beneficial because we do make a greater impact together. We share regional and state and national best practices. So things that I hear about from Michelle and the Falls Free group, for example, we bring back to the state coalition and to the regional coalitions. And it's just a great way to connect with other people committed to preventing falls. So there's a link here for a one-pager if you want to share with your organization and about what the coalition is doing to kind of spread the word. Here are the links again for the regional coalitions if you want to connect with your regional coalition as well as our state coalition. And then on the next last slide, I've listed my contact information, and you're welcome to reach out to me if you have any specific questions regarding the state coalition. So thank you. I know that was fast, but just a quick overview of what's happening in North Carolina. Thank you.
Oh, thank you, Ellen. That was fast and perfect. So much information in there and so nicely put together. And I like how accessible the information is so that if anyone wants to go in and find it and maybe find ways to use it, it's right there for you. We do have one question from Haley wanting to know if there is a printable handout version of the Falls Free Checkup. And I believe that was that is on the NCOA website, but also you have a link to it on your website, I believe. Is there a printable version for that?
Yeah, I can put that in the chat. Is the chat or the Q&A the best place for that?
I think probably the Q&A, please.
Okay, I think I was trying to do that earlier and I'll do it again.
Yeah. Okay, great. Wonderful. Well, Ellen, thank you. I know you work so hard and positively in getting all this information out and getting this, state Falls Coalition hopping and working, and it's doing a great job. So we thank you for that. And at this point, we don't seem to have any other questions from our audience. I do want to thank everyone for being here, and especially thank Michelle Mai and Ellen Bailey. Caitlin has put in the chat box the Steady brochure and Staying Independent. So we have all sorts of wonderful resources out there. Everything that this webinar, as well as the links to some of the resources, will be available on our website after the presentation. Well, probably in about several days or a week. We will also be sending out an email, though, to all individuals who registered for their webinar and providing links on that as well. Looks like I might have one more question, and this was a thank you, great presentation, and I agree. I think it was a great presentation from Michelle and Ellen. And again, we want to thank you both for being here, and thank you for everyone for attending.
Thanks so much for having me, and I hope you all have a really wonderful Falls Prevention Awareness Week.
Thanks, Michelle.
Likewise, thank you.
Thank you, Ellen.